Okay, Mr. Lewis, we're going to pick back up where the tape left off, and I'm going to check your cranial nerves number 3, 4, and 6, which is the oculomotor, the abducens, and the trochlear. And what you're going to do here is you're going to just follow my pen light with your eyes, and I want you just to look straight across and keep your eyes fixed over there on that dolphin. And we're just going to you're going to track when I tell you the pen light, okay? Just track your eyes. Keep your head fixed. There you go. Perfect. Perfect. All right, perfect. Now I'm just going to do this. All right, everything's perfect there. That's perfect. All right, so the next test then, Mr. Lewis. Okay, I'm going to ask you that you still look ahead. Keep your eyes looking ahead. And I want you to cover one eye with one hand. And then I'm going to ask you to follow my finger over here. Follow with your eye. Just your eye. Keep your head straight and then uncover your hand. Okay, perfect. The same thing with this eye. Cover it and follow my hand over here. Now uncover your hand. Perfect. Okay, perfect. Okay. Now I'm just going to check your ears. And you got good symmetry here. You have any tenderness back here?
Nope.
Let me check on this side. Okay, good. Everything is free. No tenderness here?
Nope.
Okay, perfect, Mr. Lewis. Perfect. Okay. Okay, right now I need to be checking your acoustic cranial nerve number 8. But since I don't have a tuning fork, I'm going to have to let that go. We're going to do the whisper test now, Mr. Lewis. I'm going to whisper something in your ear and you just repeat it back to me, okay? Close your other ear over there for me.
Hello, how are you?
Okay, perfect. You heard that good with no problems?
Yep.
All right, now we're going to check your nose. I'm just going to look up your nose with this pen light. I'm not going to hurt you. Take a look, put it up there. You have some hair distribution on both sides. I don't see any nasal septum deviation or any problems there. All right. Any problems with breathing?
Nope.
No. Okay, perfect. All right. Your nose is very symmetrical to the side lines of your face. All right. Next thing we're going to do is we're going to check cranial nerve number 1, which is the olfactory, which is sense of smell. So I'm going to ask that you close your eyes, and I'm going to make you smell something. And you tell me, close one of your nostrils off for me, and you tell me what it is that you smell, okay?
Cinnamon.
Cinnamon, great. Okay, perfect, Mr. Lewis. That's perfect. That's exactly what that was, cinnamon. Okay. All right, we see that your mouth is even, your lips are good, you have no cracking, no bruising, no ulceration. I'm going to start getting to the point where I'm going to look inside your mouth for a minute. Okay, so I'm going to put on some gloves here. And I'm going to ask that you open up your mouth for me here, if you will, okay? All right, great. I'm just going to have a look in here. All right, good. I see that you have your hard pellet, your soft pellet. Stick your tongue out at me. All the way. Open and stick. Okay, say 99. Okay, great. Now lift up your tongue. Okay, I don't feel any palpable glands down there. Your frenulum of your tongue is in a good place. You have no frenulums in your upper lips and your lower lips. I'm going to just start cutting your teeth. You have a few caries in there, a few missing teeth. I got 25 teeth. You're missing 2 teeth, Mr. Lewis?
Yeah.
Okay. All right. Next thing I'm going to ask you to do is I'm going to ask you to stick your tongue out at me, and I want you to move it side to side. Move it side to side. Yep, that's it. Okay, great. Perfect. Okay. And I didn't see any lesions. Your tonsils were a +1, and your uvula moved when you said ah, so that's perfect. Everything looked perfect in there. All right. And your hard and soft pellet was palpable, and that was for your cranial nerve number 12, which is the glossopharyngeal nerve, which is tongue movement, and that worked out perfect. Now I'm going to ask you to swallow. Swallow. Swallow.
I didn't.
Oh, okay. And then, do you have a gag reflex?
No.
I mean, if somebody would stick something in your mouth, would you gag?
Probably would, yeah. What?
Okay. Well, because I need to ask you about your gag reflex. I'm not allowed to test your gag reflex. So that just checks on your cranial nerves number 9 and 10, which is the glossopharyngeal and the vagus nerves. Okay, now I'm going to ask you that you take your shirt off. All right, we're going to just check your chest. And your chest is symmetrical. There's no maculas or papules. You have a few slight little, like pimple, macular, papular areas here at the midline and over on your right side of your left side of your chest. There is your breasts are symmetrical. I don't see any problems. Your tummy is fine. No problems there. Nothing tender here when I'm pressing on it, is there?
Nope.
And I don't see any exudate from your nipple lines. All right, now I'm just going to test your nipples. Just go around your breast here and just see if there's any tenderness. You have any tenderness?
Nope.
And I don't feel any masses or any problems there. Okay, that's fine. No tenderness on that side either. All right, I'm going to ask you that you cross your hands in front of you, and I want you to sit up straight, and I'm just going to test your back here, and I want you to say 99 when I go down here, just every time, 99.
99, 99, 99, 99, 99, 99.
Okay, now I'm going to just check your diaphragmatic excursion. Okay, and we're going to measure that. Okay, we got 3 centimeters, so that's good. The normal is being 2.5 to 5 centimeters, so you're within normal limits there. Okay, go ahead and sit back, Mr. Lewis. Okay, now I'm going to just listen to your breathing. I'm going to listen to your breathing. I'm going to just sit back up again. I'm sorry. I'm going to just sit back up. I'm just going to listen to your lung sounds and your capacity there. Okay, so just breathe nice and normal. I'm just going to listen side to side here. Okay, perfect. Perfect, Mr. Lewis. All right. All right, I'm going to ask you that you put your hands up on top of your head, and I'm just going to listen here to your lungs here. Just go ahead and breathe normally. Okay, perfect. Okay, just going to continue to listen.